then this person says, I've been on the protocol for 5.5 years, I'm on the right dose, I'm supplementing with fast-acting guaifenesin, I'm not blocking, and I'm clearing very gradually. Is there anything else I can do to augment clearing? I'm exercising at the gym and walking a mile daily. So yeah, just what Vicki said. Try to keep your stress as low as possible regarding clearing. Now, I want to go over the 5 game changers I have for decreasing fibromyalgia symptoms in general. The first one, and I have a handout on this that I'll give to Annette, and if you're really nice to her, maybe she'll make you a copy. But it's eating foods that help you feel well. And so that, for 30% of us, is following Dr. Saint-Amand's hypoglycemic diet. And the most interesting thing to me is that even though 30% of people with fibromyalgia are carb intolerant, 90% of my new patients are. Because, as Dr. Saint-Amand says, the people with fibromyalgia and hypoglycemia are the sickest of the sick. So the people, I generally see 3 categories of people. People that have tried everything, it hasn't worked, so they come to see me. People who've just been diagnosed and aren't interested in Lyrica as a main treatment, but want to try things to get to the root of the illness, like guaifenesin, or pediatric patients, where because I'm a board-certified pediatrician, parents and pediatricians feel comfortable with me making the diagnosis. So Dr. Saint-Amand and I have both seen people who have no nodules. They've been on guaifenesin at the right dose and without blocking for a number of years. Their nodules are gone, but they still don't feel better. And the main reason is that they are hypoglycemic and they're not following the diet. So that's number 1. Number 2 is getting consistent aerobic exercise. So if I were to take a muscle biopsy of somebody with fibromyalgia, I would find that in their leg muscle, they would have fewer mitochondria, a little part of the cell that makes energy. And the mitochondria that they had were shriveled and weren't working as well. Probably because, as Dr. Saint-Amand says with the phosphate theory, is that the mitochondria are all gummed up with excess phosphate, and they can't generate energy as well. So with the guaifenesin protocol, we're helping with that, right? We're getting rid of that excess phosphate, and over time, the mitochondria that we have are getting better, but they're still fewer in number. If you get consistent aerobic exercise, the minimum is 20 minutes of aerobic activity 4 times a week. Within 6 weeks, you'll build new mitochondria. And so, especially in January and February when I see patients, I feel like I spend most of my time talking about exercise and the HG diet because November and December, after the holidays and the stress and the busyness and the illness, a lot of people have kind of dropped out on that. So those are the first 2. And the third one is making good progress on the guaifenesin protocol. Obviously that's getting enough long-acting guaifenesin, making sure it's lasting 24 hours in your system and not blocking. Number 4 is proper hydration. If I've just talked to you about the mitochondria and you're not keeping your cells well hydrated, then of course they're not going to work very well. So that's really important. And the last is mind-body therapies to help stabilize the nervous system. So it's widely believed that those of us with fibromyalgia, if you take a look at our nervous system, it's the autonomic nervous system is divided into parasympathetic and sympathetic. Sympathetic is the fight or flight response. It's believed that most of us with fibromyalgia have higher levels of the hormones that are driving us more into the fight and flight response. It's like, oh, is that a saber-toothed tiger behind us? And so we tend to fall asleep more easily. sleep more deeply, and feel better during the day if we can do things that help balance the parasympathetic and sympathetic nervous system. Things like breathing, deep breathing. I find that when I'm taking a history from a new patient, I don't breathe or breathe very shallowly. To remember to breathe, to find whatever it is during the day, morning, and especially at night. Yoga postures, yoga breathing, Tai Chi, meditation, relaxation, prayer, whatever it takes for you to really get your nervous system in better balance is super helpful. So those are the 5 game changers, and that's going to help you feel better. Okay.